Hello everybody, my name is Stefan Henning. I'm from 4C in Munich, Germany. I'd like to introduce you to our study we're presenting here today on the 53rd ASH meeting 2011 on our HDAC inhibitor Resminostat in patients with relapsed and refractory Hodgkin's lymphoma. So the study has actually run for the last 3 years in 3 centers of Europe. We have tried actually to determine the efficacy and safety of this HDAC inhibitor in this heavily advanced and heavily pre-treated patient population. These patients actually were pretty heavily treated. As you can see here, we had a median range of prior therapies of 6 for these patients. Patients with more than 5 prior therapies, almost 70%, and almost half of them had B symptoms at baseline. We're using 2 different doses of Resminostat in these patients, either 600 milligram or 800 milligram orally. The treatment schedule, maybe if I can point you over here, we actually treated with these 2 doses. We did it daily for 5 days, and then had after that 9 days resting period, so constituting a 14-day cycle. And we repeated actually these 2-week cycles for up to 6 cycles, and after that, patients, if they still benefited, could be treated for up to 12 months in a follow-up period. Primary endpoint of the study was the overall response rate based on CT, on computed tomography, saying basically the size of the lesions combined with their functional activity based on PET. And this is actually the outcome of the efficacy. We have a total of 35% overall response rate in these patients. 7 additional patients out of 34 have achieved stable disease, so that actually results in a 55.6% disease control rate. Down here you can see that actually changes in tumor size in this graph and changes in target lesion metabolic activity actually corresponds very well with the 2 different doses. Here on this diagram we see that the green bars are basically accumulating on the right lower side, and here the red bars, which correspond to 800 milligram Resminostat, are basically clustered in the lower right part. And you also can see that basically treatment with Resminostat correlates very well with the reduction of the size of the target lesions and their metabolic activity. Over here is the progression-free survival data, and it's very clear that the responder group, which is represented by the blue bar, has a substantially longer progression-free survival of a median of 16.1 weeks compared with the patients who have only achieved stabilization of disease, which is basically a median of 8.9 weeks. Lastly, the safety. Resminostat has been very well tolerated in these patients. We have seen typical side effects in the GI area, like diarrhea, nausea, and vomiting. We've also seen some hematologically associated side effects, in particular notable here anemia, which actually has not changed its occurrence from the 600 milligram to the 800 milligram dose, but other side effects like fatigue really have increased when patients were treated with the higher dose of Resminostat. So overall, the conclusion would be that from the safety side, Resminostat is actually a very good candidate for further combination therapies, not only in hematological indications, but also in solid tumors. And 2 more phase 2 studies in solid tumors are currently running with 4C, one in liver cancer and the other one in colorectal cancer, in combination with established standard therapies. Thank you.